covering essentially what the disease is, the causes that lead up to this disease, diagnostic procedures, the signs that show up when a person has CAD, ways it could be prevented, and lastly, the treatments for this disease. Coronary artery disease is a type of heart disease. You've probably heard other names for it, such as coronary heart disease and ischemic heart disease. They're all the same. CAD is when the coronary arteries can't supply a sufficient amount of nutrients, blood, and oxygen to the heart. Knowing that our organs have its own blood supply, so does the heart itself, known as coronary arteries. Now, imagine the heart's arteries, which is the blood vessels that supply blood to the heart, are blocked. It will lead to a severe chest pain and/or a heart attack. Here's a comparison of a normal artery versus someone who has CAD. Following up with atherosclerosis, this condition leads to poor circulation, with a decreased blood flow by the formation of blood clots. This particular blood clot is a buildup of plaque in the arteries that is essentially a buildup of fatty acids, calcium, and cholesterol that, as they increase, they will gradually form what we call plaque in the artery wall. Due to the buildup of plaque, it calcifies, meaning they thicken and become hard on the walls, thus clogging the arteries. In short, plaque narrows the artery that slows down the rate of diffusion, which makes it harder to circulate blood efficiently throughout your body. What happens is your heart would eventually run out of blood supply that keeps the heart muscles from performing its job. Did you know? Atherosclerosis is a major factor to many heart diseases. To put it simply, too much or too little of one or the other will have a negative impact on your body that can eventually develop atherosclerosis. LDL, low-density lipoprotein, is the bad cholesterol. Better to have a low cholesterol for this. And HDL, high-density lipoprotein, being the good cholesterol, with a sufficient amount that's not too less for this. According to PubMed Central's website, CAD is 40% to 60% leaning towards heredity. If any of your relatives had CAD, you tend to have a 50% chance of getting this disease. CAD falls in all age groups, but the risk increases as one ages. Patients over the age of 60 are more likely to get it. This could vary in gender. Men tend to be at risk that are over the age of 45, while around the age of 55 or over for women after the menopause. This disease is also more common in certain ethnic groups like African American, Hispanic, and Native American. Genetic factors that could be the cause encompasses health conditions like a family history of heart diseases, diabetes, and high blood pressure and cholesterol. Having a high cholesterol increases the rate of plaque growth. Having a high blood pressure makes the arteries less resilient through the thickening of the walls. The plaque buildup becomes hard and excessive that decreases the blood flow of cells. Those with diabetes don't produce enough insulin that are there to help regulate blood sugar, but since they lack insulin, the blood sugar will just remain in the bloodstream and will lead to a plaque buildup. Approximately 80% of people with diabetes succumb to this disease. These habits and environmental factors lead you to coronary artery disease. Smoking not only affects your lungs, but also your heart. Obesity/overweight contributes to high blood pressure and diabetes. Being inactive or not engaging in physical activities can affect your health and is associated with CAD. Too much consumption of alcohol raises blood pressure. And lastly, having an unhealthy diet puts you at a high risk with CAD. Rather than self-diagnosing, your best bet is to reach out to a doctor like a cardiologist. They will suggest the following treatments and tests to further diagnose. First one being the echocardiogram that utilizes sound waves to create images of your heart, giving a clear picture to your doctor how your heart is functioning. Many of the equipment are given medications for patients to relax during the tests. For the transthoracic echocardiogram, your doctor will use a device called the transducer to measure sound waves after applying gel on it and moving it across your chest, with the computer turning echoes into clear images of the heart. Or the transesophageal echocardiogram, if your doctor requires a more accurate image of your heart. This is done by taking medications as to numb your throat before the transducer. They'll be applied tube traveling down your oesophagus. Both echocardiograms detect your heart's speed and direction of blood flow. The stress test is highly recommended for those who might have heart problems since symptoms of this disease shows up when doing physical activities. Pictures of your heart will be taken using ultrasound prior to and right after you go on the treadmill or other exercising equipment. The CT angiogram is a much better option compared to a standard angiogram since it has a lower dose of radiation and is done by a non-invasive procedure. The computerized tomography coronary angiogram generates images of your heart and its blood vessels through an X-ray machine that allows it to look for narrowed arteries. Lastly, cardiac catheterization utilizes catheter, a thin flexile tube that moves along the blood vessel to the heart to find blood clots in arteries or abnormal heartbeats. There are 3 types of CAD. The first symptom of chest pain is associated with the non-obstructive CAD that doesn't narrow the arteries as much as the next type. Heart attacks with obstructive CAD since it interferes with the blood flow. Or the severe one, which is spontaneous coronary artery dissection that consists of all the symptoms. CAD is initially asymptomatic, which means it might not show signs until it progresses, although it progresses super slow. Other symptoms can include fatigue, always tired, carried with excessive cold sweat like chills, constantly vomiting or feeling nauseous throughout the day, discomfort in jaw or pain occurring after a heart attack that could spread to those areas, and you tend to faint or feel lightheaded. For instance, there could be times when engaging in intensive activities, you may have chest pain, angina, and with difficulty breathing due to shortness of breath. While you're performing these tasks, your coronary arteries are also working hard to supply blood to the heart. However, with the narrowed arteries, the cells would have less space, hence a poor circulation of blood flow going. So, CAD is not an infectious disease, and there's currently no cure for it. Although it can be treated by looking into secondary causes that could be taken to lower the risk, these changes can be small but impactful later on. Like I've mentioned about the causes of this disease, in order to prevent it is to quit smoking because it will only aggravate the narrowed vessels. The chemicals in cigarettes increases the blood clots and arteries. Obtain a healthier diet that lowers the cholesterol level, such as including foods high in soluble fibers like oats, nuts, beans, seeds, and berries, as well as food that are rich in omega-3 fatty acids like fish, can aid in lowering blood pressure. Importantly, staying away and cutting out processed high-fat and high-sodium foods. Exercising frequently helps lower cholesterol levels, especially to obese patients with CAD during weight loss. It could range from a light jog to biking or even swimming. Believe it or not, being overly stressed can contribute to high blood pressure, hence a high risk for heart attacks. So find a method that can keep you stress-free will help. Routinely taking your medications so it can lower your cholesterol that can prevent plaque buildup in arteries. Finally, avoid consumption of alcohol since it raises the blood pressure. To take away from this is that it's crucial to lower cholesterol, keeping blood pressure under control, and to manage a healthier diet. Prior to leading up to coronary artery disease, early recognition enables surgeries like CABG and coronary angioplasty. CABG, coronary artery bypass graft, can only be performed on patients if they're suitable depending on the results after the angiogram. This open heart surgery is done by inserting a breathing tube through the patient's mouth as an anesthesia, and a machine will do the pumping for it because the heart will be stopped. For the most part, they use the healthy blood vessels taken either from the leg or the chest wall on the inside, now called the graft, to attach it to the aorta and the blocked artery as to provide a new blood flow. And there could be many blood vessels or grafts inserted to maintain a stable heart. Onto coronary angioplasty, it utilizes a catheter that is made up of a wired tube, a stent, with a deflated balloon on the inside. What the balloon does is when this goes through your blocked artery, the balloon will grow and push the stent that's wrapped around the balloon to expand and break the buildup of plaque that will create a clear path in the artery. Afterwards, the stent will remain in the artery, but the balloon will be taken out. And there's heart transplant if medications can't be managed or the grafts, new blood vessels, start to form plaque. Not only will these surgeries improve the condition, but also ensures a longer lifespan. However, there's always a risk to things, and that being said, the patient could develop strokes, kidney problems, and abnormal heart rhythm, infections, and other complications. With the right treatments, you can still live a full life with CAD, but to most that aren't as fortunate, with about 16 years taken away solely from heart attacks. Essentially, there are 3 stages of the primary cause of this disease, which is plaque buildup. The stage where it's safe is stage 0, no plaque. Then moving towards stage 1 as being diagnosed with this disease, mild plaque. Following up with stage 2, moderate plaque. These 2 stages can be managed by lowering the cholesterol level by taking medications like statins. And the last stage, severe plaque with a lifespan of less than 1 year. CAD is the most common heart disease and the main cause of mortality rates in the United States, with 382,820 lives taken yearly by year 2020. Thank you for listening and stay safe.